Thank you. Good afternoon. How are you doing, Dr. Strang?
Thanks, Premier, for asking, but I have to say I'm a little nervous. It's the situation is making me very anxious.
Yeah, it's been a tough couple days for sure for our province. Dr. Strang and I have been on some daily phone calls, especially over the last 48 hours, talking about the situation. We're worried. Our COVID cases are climbing at a rapid rate. We're reporting 63 cases today, the highest count ever since COVID entered our province. And 52 cases on Saturday, so we're seeing multiple days of double-digit cases. This is concerning and very serious. I don't like the trend I'm seeing. And while the majority of cases are in Halifax area, it is now spread to every region of the province. The virus is spreading and we have to find a way to contain it. Large social gatherings in the middle of the lockdown are not helpful. I was infuriated to find out about a household gathering, a party, in Halifax in the middle of a lockdown. Dr. Strang and I are both so frustrated about this irresponsible behavior. Why? Why would you put yourself at risk? And worse, someone else. It may be fun in the moment to gather with friends who have no concern for COVID, but how would you feel if you put a loved one in danger who cannot fight this serious disease? We were relieved to hear that police acted quickly and issued fines, but the current fine does not seem to be enough of a deterrent. So we're doubling our fines from $1,000 to $2,000. I want to thank our regional police for understanding the seriousness of these gatherings and acting in the best interests of Nova Scotians. I also want to thank the majority of Nova Scotians that are listening to public health protocols and showing up in droves to get tested. Dr. Strang and I are grateful for those that are continuously cooperating with the protocols, and seeing the long lines of people getting tested is heartwarming. I just saw another line at the convention center on my way in today. The vaccine rollout is continuing, and I'm also grateful for those who are going out to get that shot in the arm. All of this is helping, but sadly, it isn't enough. COVID loves movement and social gatherings. So the only way to slow the spread is if we limit our movement. We have already asked you not to travel in and out of the Halifax area, but we need to take this further. You should not travel outside of your community. So that means if you live in the Annapolis Valley or Truro, you cannot go to Cape Breton. If you want to go to a park for a hike, go to a park in your own community. This does not apply to those who have to travel for work or if you have a medical or a legal appointment. If it is not essential, simply put, stay in your community. We are putting this order in place until May 20th, at which time we'll do a full review of the order and the Halifax lockdown. COVID also loves a crowd, so we're going to reduce our gatherings. We're reducing our gathering limits indoors and outdoors to a limit of 10 outside of HRM, including your family household. We are reviewing other gathering limits for cultural events and sporting, and we'll have more to say on this tomorrow. Now, before I turn it over to Dr. Strang, I want to take a moment to talk about our schools. Let me start by thanking all of the teachers and principals and support staff who are working hard to continue to keep our children and our schools safe. But no matter how hard everyone is working, COVID has found a way into some of our schools. I want to reassure parents, those schools are closed for deep cleaning, and anyone who has tested positive are following the protocols and self-isolating. Other schools will remain open, but we're constantly monitoring the situation, and if we should have a more serious outbreak, we will react quickly. Dr. Strang, I'm going to turn it over to you, and I just want to continuously thank you for the work that you're doing, especially now as we get these higher case counts, and you've been working hard over the last year, so I just wanted to thank you.
Thank you very much, Premier, and there's hundreds of people behind me working equally hard, so I appreciate that. And good afternoon, everybody. It's been a long time since we felt the need to hold a briefing on a Sunday. But with a record daily case number, we need all Nova Scotians to know how serious our situation is. 63 cases is the highest number of daily cases we've reported since the pandemic began. And I expect high numbers in the next few days. We continue to see high case numbers in the central zone. There is community spread in the greater Halifax area. but we put the right things in place to get things under control with restrictions and by increasing our testing capacity. If we all do what we need to do, these numbers should start coming down later this week. And right now, we've not seen any confirmed signs of community spread outside of the central zone. However, we are closely watching a cluster of cases in the eastern zone in Cape Breton related to a hockey games played on April 17th and 18th in the Member 2 Arena. Everyone who was there on those dates needs to be tested, and once they're tested, or they should need to isolate right away, and you can come out of isolation to get a test, and then you have to stay in isolation until May the 2nd. And there is a high-risk notification. It may have gone out, or we will be going out from the health authority later today on this. And to complement that, we are working rapidly on standing up a temporary assessment center for the more accurate PCR testing, and that's for people who have symptoms or identified as a close contact, as well as pop-up rapid testing in Cape Breton for this week. Nova Scotia Health will share these details very soon. We have significantly increased our testing capacity across the province, and we're close to having the ability to test up to 15,000 Nova Scotians a day through primary assessment centers, pop-up sites, and mobile testing, and we're working on adding more. The lab has also added capacity to be able to process these tests. To put that in the context, at the beginning of the pandemic, we could do 200 tests a day. Now we're close to doing 15,000 a day. And let me take a moment too, because sometimes there's confusion around the two types of tests. The primary assessment centers and some of our other testing, it's for people who are identified as contacts or have symptoms, and because of their higher risk, they need a PCR test. At the pop-up sites, we are using the rapid tests, which aren't as accurate, but they're good for the people who are low risk, people who have no symptoms whatsoever and are not associated with any exposure to COVID. I think it's important to understand. So if you're identified as having potentially been exposed or you have symptoms, you should not go to a rapid pop-up site. You need to make an appointment and go to one of the standing sites, the primary assessment centers. And I want to thank all the Nova Scotians, the thousands who are coming out for testing over the weekend, and the hundreds of people in the health system who have been working many hours over the last number of days to build and maintain all this capacity for testing and the lab, as well as for the many people in public health dealing with the ongoing investigation of the dozens and dozens of cases and contacts that we're dealing with. And the response from Nova Scotians in general continues to amaze me. We have asked people to come out and get tested, and once again, you have done that, and I appreciate that. On the whole, Nova Scotians have worked very hard to keep COVID-19 at bay. Most of us follow the rules and do what needs to be done. There are always a few, though, and we read all about them this weekend, who flout the rules and put everyone at risk. There has been a lot of attention paid to a high-profile weekend party and photos circulating of the party on social media. The callous and casual behavior of these individuals is just wrong. There were other events, however, where people were fined, and lots of reports of people leaving HRM for shopping and recreation. So these aren't isolated events. There seems to be lots of them. And I know these examples make people angry and afraid. But I would ask that we all focus less on what others are doing and more on making sure that we as individuals and families are following COVID restrictions. We can't control the behavior of others, but we can control our own actions. Doing the right thing, making the right choices, and following the public health measures is how we can show we care about our communities and one another. Make no mistake, this is a serious situation with lives, jobs, and futures at stake. Each of us needs to respond with the necessary focus and caution. It has to start with everyone staying much closer to home, in your neighborhood and in your community. By all means, get outdoors, enjoy the weather, enjoy our beautiful province for our mental and our physical and our social health. Just do it in your small family or close social groups, and do it close to home. It should only be essential shopping only, and minimize your trips and consider designating one person in your household to do the shopping. This is what we did a year ago, and we need to do it again. Across the whole province, if you can work from home, please do so. And employers, please be flexible and support your employees to work at home if their jobs allow. I'll close by saying that people seem to be treating the situation we're in as something that's only impacting Halifax. If you think that, you are very, very wrong. COVID-19, especially the variants, does not respect borders. That's why the Premier and I are discussing what we need to put in place to protect the rest of the province. So if what we start to see does begin to spread outside the central zone, we will have things in place to slow down its spread. It only takes one spark to start a forest fire that could quickly get out of control. We need to assume that all cases are variant cases. They spread more quickly and more easily. People are becoming positive after having moderate exposure to someone with the virus, and we didn't see that during wave 1 and 2. So again, this is serious, and we all need to buckle down. We need to minimize non-essential gatherings and reduce our close contacts. Stay close to home, get tested, stay home, even if you're feeling slightly unwell. Don't lose hope, but please take this seriously. Look at what's happening in other jurisdictions. We've driven COVID out of our province before, twice, and we can do it again. By acting now and working together, we can protect each other, the healthcare system, our schools, and the rollout of the COVID-19 vaccine. We can get COVID back under control so that we can have a safe and less restricted summer. But however, ultimately we can put restrictions in place. The healthcare system can ensure access to testing and vaccine. But ultimately the path this takes in the next few weeks is up to each and every Nova Scotian. Now is the time for each of us to be our best. I was asked yesterday about the COVID storm. My response is that we can be the storm and roar back. Lock arms, Nova Scotia, and stay strong.
Thank you, Dr. Strang. We'll now take one question and one follow-up from media in the amount of time that we have. We're going to begin today with Rebecca Lau with Global.
Oh, hi there. Actually wanted to talk a bit about daycares. We know that there have been cases confirmed in daycares, especially in HRM, but they're not being reported publicly. Why is that?
We certainly are reporting when we're aware of a daycare. That's part of what we talk about publicly when we have a daycare case. When we have a case in a daycare, the individual daycares are closed down generally for 3 days, and I know the Department of Education and Early Childhood Development is working on how they support those daycares for those 3-day closures.
Do you have a follow-up, Rebecca?
So daycares are closing, you say, when there's a positive case for 3 days?
We have a case in the daycare like we're doing in individual schools. Our process is to close them down for 3 days, and they're getting support from the department, as I said, the department on that closure.
Next, we'll go to Brooklyn Curry with CBC.
Hi, thanks very much. Premier, you've characterized the call for people to stay in their communities and close to home an order, but, is this announcement today really any different than what was announced specifically for the Halifax region earlier this week, in the sense that, it's not an order, so it's not enforceable by law the same way gathering limits are? What can be done, if anything, to enforce this?
So we are signing an order. We haven't done that yet, but I felt it was needed to get out on a Sunday to let people know that they shouldn't be traveling around the province. So what's new is that we're concentrating on the whole province and not just Halifax. So if you're in any community, any given community outside of Halifax, you should stick within your given community. If you're in Bridgewater, you shouldn't be traveling to Yarmouth and other parts of the province. There are parts of the province that we've been fortunate not to see a lot of COVID activity, and we want to keep that out. So we will be having an order signed. Brooklyn, do you have a follow-up?
Thank you. Yes, I do. I know that you touched on schools, and you say that, while some schools have closed after having positive COVID cases, others are remaining open, and you'll assess as you move forward and the situation changes. But some students and parents are calling on all schools, specifically, within HRM, to be closed. What do you say to those students and parents who are, fearful and anxious about returning to school?
I can certainly understand the worry, and we're going to continue to make sure that we're acting swiftly. So we've gone beyond just the school and looking at families of schools, because we know that there's clusters in some communities. So that's why we took action right away. But we have to children are in is a positive thing for them, for their own mental well-being. If at all possible, experts say that kids should be in school. So we'll continue to make sure that we are listening to that, and the parents that have said that they want their kids in school. We want to make sure that we're being reasonable and that we're following whatever public health says is the necessary steps that we're taking. But at this time, there's no requirement to go beyond the immediate family of schools that have been impacted.
Next, we'll go to Sarah Plowman with CTV. There?
Yeah, sorry about that. So, Premier, you've been you've expressed very harsh words towards these university students who partied on Friday night, and we know that there was another gathering last night. People were fined. But I think Nova Scotians also want to know why people haven't been fined in the case that sort of was significant in causing this, and why that information, why you haven't been able to track them down and hold people accountable for what happened.
Well, I can certainly understand the desire to look for reasons of why cases are increasing, but the bottom line is we all need to do our part, and we'll get through this. If we have evidence to lay charges, then that will happen. Enforcement is independent of government. They take the action required to ensure that fines are in place. I've heard of other calls. It's not just the one party that bothers me. It's the calls that police had to attend to last night. Many calls were taken to look at gatherings that were taking place. So rest assured, people will be charged. And now we're increasing that fine because obviously some chose not to respect the order, and some actually flaunted it. That's not the Nova Scotian thing to do. At the same time, I'm pleased with seeing people turn out and getting tested. So I still have optimism, but it's a disappointing weekend for us.
Sarah, do you have a follow-up?
Yeah, I'm wondering, before this announcement, some people I was speaking with were wondering whether we're going to see a full lockdown. I mean, what would it take for the province to then go and make that decision, for us to be in a situation where we were last year where everything is closed, parks included?
So I think we put a number of measures in place on Friday. They've been in effect for around 48 hours. They will take some time. What we're seeing the activity you see in front of us, like today, that was the result of things that were happening in disease transmission a week to 2 weeks ago. So it will take at least, we need to watch at least for about a week. I expect that by the middle towards the end of this coming week, that if what we're doing is having its impact, we will start to see some of the things trend downward in the Halifax area. But it'll take at least another week, or if not beyond that, to really see the full effect. So we have to have some patience. At the same time, we need to be careful if we're seeing the trends, the troubling trends of things spreading outwards, and we're getting out in front of that by announcing today, and what more details to come tomorrow. I have looked at the measures that were taken, for instance, in Newfoundland when they had their response to their outbreak, and in New Brunswick, what they've done around the Edmonton area, and they're by and large, to a large extent, what we put in place as Halifax is already consistent with what those jurisdictions put in. If we need to tighten up in some areas, there are some places we could go further, but it would be premature to make the assessment that what we're doing is not working.
Next, we'll go to Sarah Smelly with the Canadian Press. Go ahead, Sarah.
Hi there, Dr. Strang. You mentioned that you expect cases will go up in the coming days. Can you elaborate a bit on that?
Other than I can't give you a number. Where yesterday was 53. Today it's 60 something. I expect to see for the next few days our cases are going to be in this, in the 40s, 50s, 60s, maybe even a little higher. That's entirely as we're having more spread, but it's also a result of the fact that we're testing a lot of people. We're testing thousands of people. Even our percent positivity rate of all the people we're testing is still below 1%. But when you test thousands of people, that you're going to get a number of people that are positive. That's exactly how it's supposed to work. That we want to identify these people, get them tested. Now we know they're positive, and then we can isolate them and put quarantine on their contacts. If we weren't testing these people, often they're very mildly ill or have no symptoms. They would still be going about their daily lives, continuing to transmit to others. So the fact that we're seeing more positives is a part of it is a sign of the impact and the success of our widespread testing strategy.
Sarah, do you have a follow-up?
Yeah, just with respect to that widespread testing strategy, it's my understanding that you train volunteers to do some of this testing at your pop-up clinics. I'm wondering if you know approximately how many volunteers have been trained to date to do this.
I don't have a number. That's one component. Dr. Lisa Baird and her team are leading that pop-up testing of, volunteer-driven. We also have we're working with a company, Praxis, who's doing both pop-ups and supporting our PCR testing. We've got, the Nova Scotia Health Authority and IWK who are significantly redeploying their staff to support a rapid expansion of the PCR testing. We've got Halifax Fire, and we're looking at other volunteer fire departments. I believe there's one down in the Annapolis Valley who's rapidly being trained. So we're building capacity in a number of ways. The volunteer-driven rapid testing is just one component. And I do have to, again, emphasize that our main focus for testing has to be people who are known contacts or have symptoms, and that is through the PCR piece. We need to supplement that with the rapid testing of PCR, but that's for people who are completely asymptomatic, and that can only be a portion of our overall multi-pronged testing strategy.
Next, we'll go to Bill Spur with the Chronicle Herald. Okay, we'll come back to you, Bill, if you're there. We'll go to Kathleen Jones with All Nova Scotia next.
Hi there, Dr. Strang. I'm wondering now that the AstraZeneca vaccine has been approved for people 30 and above, are there any plans to expand to that age group right now in Nova Scotia?
So it's the recommendation from NACI, which references the age 30, if you read the full recommendation, that age is based on, as I said at previous briefings, is based on the epidemiologic picture within a jurisdiction. So it's not just the vaccine, does the epidemiology, and it's balancing the risks of a severe, but rare, but severe. 40% of people with this clotting event do actually die so far, is what the literature is showing us. So it's not trivial. There is where we have to balance out the risk, the rare but severe risk from the vaccine versus the risk of a severe outcome from COVID. And when the epidemiology is low, like it still is in Nova Scotia, we've looked at our case rates and we're still within the range that NACI is saying, the low epidemiology. The risks for younger ages of the vaccine outweigh the chance of a severe outcome from the vaccine is more than the chance of a severe outcome from the virus. That risk calculation is very different in a jurisdiction like Ontario or Alberta, where they have their rates of COVID are far, far greater than us. Then in those jurisdictions, actually, the balance tips, so the risk justifies the use of the AstraZeneca vaccine for younger age groups, but not here in Nova Scotia at our current epidemiology.
Do you have a follow-up, Kathleen?
Yes. Iain Rankin, I'm wondering now, where are you seeing some businesses that are completely closing down this Henry House for 2 weeks due to closures on transit? And I'm wondering what kind of new supports for businesses might be coming.
Yeah, supports for businesses will be very similar to what we had in place in previous waves. So there's a small business impact grant I believe it's 15% of revenue, that gross revenue up to a $5,000 grant is one of them. So we're working very quickly to make sure that we have something in place this week, and we'll be able to help those businesses that that had to close because we had to look out for public safety first. So we recognize that they're going to have an impact, and we'll be there to support them.
Next, we'll go to Ian Nathanson with the Cape Breton Post. Go ahead, Nathan.
Thank you. Dr. Strang, first of all, you mentioned about the travel restrictions from say, somebody from Annapolis Valley going to Cape Breton not being allowed. What about people within Cape Breton? I mean, we're just starting to see sort of small exposures now, but are people within Cape Breton still allowed to travel within the island?
No, what we're saying to people is stay with it. Non-essential travel. We recognize people have to go to work, legal reasons, medical appointments, and you can travel where you need to travel for those. But for non-essential travel, social visits, getting out and about, stay within your local community. So even within Cape Breton, if you live in the CBRM, stay within CBRM. If you live up in Inverness, stay within Inverness. If you live in the valley and you live in the Berwick area, stay within the Berwick area.
If I can just add to that, I think it's all comes down to common sense. We all remember Dr. Strang saying that over and over again in previous waves. Use your common sense. If there's a park nearby, there's no defined boundaries. COVID's on the move. So if you can stay in your community, please do so.
Ian, do you have a follow-up?
I do have a follow-up for Premier Rankin. We're assuming now that we can get things under control within the next month or so because we're supposed to be having new airlines coming in and new business. And I'm just wondering how that might be affected, and additionally, if this might affect the reopening of the Atlantic bubble.
I'm not thinking about anything except the immediate concern of bringing these case counts down. This is the focus. It's a lot of pain for people and businesses, but the sooner that we can do this, the sooner we can start to think about what a summer might look like here. But if this doesn't get controlled soon, those types of scenarios, bubbles and flights coming in here are not going to happen. So we need to come together and make sure that we're following the public health protocols. Pretty simple. Continue to listen to the public health guidance and stay home.
We'll go to Tim Bousquet with the Halifax Examiner next. Tim, do you have a question?
I do. Hello. Dr. Strang, I wonder if you could speak a bit about contact tracing and transmission. It sounds as if the contact tracers are somewhat overwhelmed. And can you give us, do you have any indication of how transmission is happening, and especially has there been transmission in schools?
So I had trouble hearing you, but I'll try to answer you. I mean, we've had to modify some of what we're doing within public health. So in the case, as we do the analysis, and if there are situations where we would judge them to be a low risk of transmission, then we're really, we're setting those aside, and we're focusing on the really high risk areas and high risk of transmission. And part of that is we know that in HRM with the widespread, all of us have some risk of being exposed to COVID. So it comes down to really all of us being very careful in what we do and getting tested regularly, which is the advice we'd basically give to people if we were identifying them through individual follow-up as low-risk contacts anyway. The second part of your question, we have had, by and large, we are not seeing transmission within schools. We've had a few schools where there has been, from one case, there's been 2 or 3 other cases within a classroom. We expect that to happen when you have a classroom situation, but only within an individual classroom. I think it's important to understand that our schools remain safe, that what we're seeing by and large are people who are infected in the community and they happen to work or go to school, and we're seeing minimal amounts of transmission within the schools. I think that's important for people to understand that, and it's not that the schools are not driving transmission of COVID. Communities are where COVID transmission is happening, and that's why we need to focus on bringing down rapidly the rate of transmission in our communities. One of our core priorities has to be to have our kids to be able to be in school for their education, for their social, emotional, mental health. And many kids actually rely on schools for things far beyond education, for meals, for social supports. It's critically important that we keep our schools safe, which means that we all have to work to keep our communities safe.
Do you have a follow-up, Tim?
I do, for the Premier. I'm hearing reports that some businesses have employees who are required to self-isolate because they've been at potential exposure sites, and yet the business managers or owners are telling them they have to come to work, or they're potentially lose their job. Is there a legislative or health order approach that you can take to prevent that?
So certainly under the public health order, people who were required to isolate, their employer cannot tell them to override that isolation. If employees have concerns about how they're being treated, we certainly have I don't know the number off the top of my head, but there is an occupational health and safety line that the province runs that they could express their concerns to.
We're going to jump back to Bill Spur with the Chronicle Herald. Bill, are you there? Okay, we're going to move on to Ashley Burke with CBC National.
Hi, Premier Rankin. Some premiers have been calling on the federal government to impose bans on international flights into Canada to limit variants. There are discussions with Ottawa about that. Are you part of those discussions, and do you think there should be tougher restrictions when it comes to international flights?
That issue has not been raised in the last couple of meetings that we've had as premiers, but it is something that I think we should remain focused on. In this province, we do a lot of testing, but we also have concerns within our own country. So we're looking at what we can control, which is strong border restrictions. We've said that. No travel into the province unless it's essential now, unless you're in Newfoundland or PEI. We'll continue to focus on what we can control, and when we have that discussion with the federal government, I'll be there to support my fellow premiers.
Ashley, do you have a follow-up question?
Yeah, for you, why is it so important to increase some of the restrictions at the border? What would that look like for you, especially right now because of all the variants?
Well, variants take this to the next level in terms of spread, so I am really worried. When you see what's happening in other provinces, thousands of cases per day, we're working really, really hard to prevent that. So public health has been really good to put forward these restrictions. So we'll continue to monitor and ensure that we're really quick to shut down, and then we're cautiously slow to open back up. That's been the strategy that's worked really well in previous waves. So if we continue to make sure that we're looking at suppressing cases and keeping people from moving around, then I think we'll be in good shape, but people need to listen.
And that's all the time we have for questions today. Go ahead, Premier.
Thank you. It's been a rough few days for us all. I know you're worried, and so am I. I know you're tired. COVID has been in the midst for over a year, and it's still finding ways to creep into our lives and daily routines. It's hard not to throw our hands up and say the heck with all these restrictions, but we can't. We can't stop now. Not when we are so close. Our vaccine program continues, and as long as we have supply, we will be moving down through the age groups. And while we wait for everyone to get their shots, we have to continue to follow public health protocols. Those three things that you're probably tired of hearing: wash your hands, wear your mask, and keep your distance. You have to follow these latest restrictions. It's not easy as your premier to tell you that you cannot leave your community to visit loved ones, or even worse, that you cannot visit your mother on Mother's Day. But we've put these restrictions in place to protect you. If we slow our movement, we have a better chance of slowing the spread. I want to thank Dr. Strang and his team and all of those frontline healthcare workers for working tirelessly to keep us safe. We owe them a debt of gratitude and so much respect. The best way for us to show them how thankful we are is to follow these protocols to help reduce the case of COVID in our communities. And if we can do that, we can stay strong and stick together by staying apart for a little while longer.